morning, everybody. Today we're here to learn about fentanyl, and I'm actually going to talk about the broader issue of opioid overdoses in youth and the prevention and response efforts that we have engaged in with our community as a public school system and as part of Montgomery County. So thanks so much for coming tonight. So opioid-related overdose is a youth opioid-related overdose is a national public health crisis. You've heard about it a lot locally, but these are trends that have been happening nationally for a couple of years. Last December, the CDC put out some data that showed that opioid overdose deaths in 10 to 19-year-olds increased by 182%. And the huge majority of these deaths were due to illicitly manufactured fentanyl. So we'll learn a little bit more about that in just a moment. But first, I wanted to sort of describe the issue for you. I'll be presenting county level data because in the public school system, we don't collect the health data that affects our kids outside. Most of the overdoses that we are seeing in the county are actually occurring outside of the school system, out in the communities. When we look at how big is this a problem and what's happening and what are the trends, we rely on our county public health and safety partners to let us know what's going on. What are EMT responders seeing, and what are the emergency rooms seeing? So I'll show you today emergency room data. So these are yearly trends in emergency department visits due to opioids. And on the left-hand side, you'll see 10 to 21-year-olds, and on the right-hand side, adults 22 years old and older. You can see from 2017 to 2023, there's been a really steep increase in both opioid poisonings and opioid-related emergency room visits. So opioid poisonings is when you're going to have more toxic effects, like an overdose, and opioid-related emergency visits may be due to other reasons, or the effect is not so toxic. So that's why the orange lines are more than the blue lines, but you can see that the growth in ER visits for opioid-related things was much higher in youth than in adults. And this is what's concerning. So we sometimes hear that it's not getting worse in terms of general population statistics, but when we break out the kids, we really do see a huge rise in the past 2 to 3 years. And then when we break it down, kids are now maybe almost a quarter of opioid overdose related visits. This is in fiscal year 2024. The fiscal year is July to June in our county. So these data aren't even complete for a full year, but you'll see that 10 to 17-year-olds are almost as common as the young adults 18 to 21-year-olds. And then when you look at the 10 to 21-year-old groups of teenagers and young adults, you'll see that it's about equal, with a little bit more males in the group who are coming into the emergency room. And then when we look at other demographics, we see that Hispanic males are the largest demographic group. These data are only for the 10 to 21-year-olds. And when you look at males only, they're an even larger proportion of the group. And one thing that we say about fentanyl overdose is how big a problem is it? We are really seeing it everywhere in the county. So I like to say, though, it might not be everywhere all at once. It could be anywhere. So it's really important to sort of understand what the trends are. The other thing that makes it so worrisome is it's so potent and dangerous. So just to pan back, what is fentanyl in the first place? It's one type of prescription pain medication in the opioid family, along with morphine and codeine. It is a synthetic opioid, and it's 50 to 100 times more powerful than morphine. Usually in the medical community, we're using it for very severe pain, often in a hospital setting, but now more and more illegally manufactured fentanyl has been flooding the illicit drug market and showing up in almost any drug product out there. If you look on the upper left, you can see that fentanyl is a cheap way to augment drug products. So they often it's often found in pills that are marketed as something else. This is a picture of Adderall, who, a kid might get it from their friend to do better on a test without even knowing that there might be fentanyl in it. So because it can appear in counterfeit pills, and there's not a lot of regulation of the illicit drug market, the person who is using might not even know that they're having side effects due to fentanyl, and that delays care when you don't know what you're taking. We do have kids who know that they are taking fentanyl and doing it on purpose as well. But this is one of the reasons it can be very concerning, because it can show up almost anywhere. And at the same time, a very, very small amount can be deadly. So you've seen this picture a lot. Sometimes they show it next to a penny, but really enough to fit on the tip of a pencil can be fatal. The other thing that we've seen is that it's marketed for younger audiences and on social media. So there was a time when you may have been hearing about rainbow fentanyl, and illicit drugs containing fentanyl were being made to look like gummies or candy. So they would be more appealing to a younger market who are being reached through social media. And the last thing to worry about is, because it is so potent, it can foster addiction. So someone who's using frequently will find that they have to use multiple times a day. Otherwise, they experience really bad withdrawal effects once they're using regularly. So it really can foster addiction and other harmful effects to the developing and growing adolescent brain. So what are we doing in the public school system? We really work with our community, with county and community partners to coordinate prevention support. First of all, we want to maintain a safe and drug-free school environment, and also make sure our kids and families are connected with supports and programs. Many of the substance use supports and programs are out in the community, offered by medical providers and various organizations. So making sure we know what's out there and we can connect them with our schools is really important. We also offer resources. We really believe that families and youth should be empowered to act, to have knowledge and to make a difference. We've heard a lot of that from our youth and families. And then also being a reliable source of information of overdose trends, what crisis resources are available. And we started this journey by thinking a lot about responding to overdose and making sure everybody knew about naloxone, which is an overdose reversal agent, and how to access it. And you don't have to look at all the tiny print in this, but this just shows you all the different actors in our community who are working together. Often when we do press releases, we'll be side by side with the county health department, our law enforcement partners. You can see the emergency department folks, EMS, public safety, community members, mental health providers out in the community, and community-based organizations, including public schools, all have to understand how to work together to combat this complex epidemic.
Hi, sorry, did you want to advance the slides?
Yes, I didn't realize that the slides were not advancing. Thanks for letting me know. Are you seeing okay, great. Let me know if we have to do a redo. All right. So what did we do last year? I said we started out with talking about crisis resources. We sent out messages to the community, letting them know first, this is kind of what's happening. At the very beginning of the year, we joined with Montgomery Goes Purple for National Opioid Overdose Awareness Day. The very beginning of the school year was the first week of school, just to raise awareness. So the first step was really going out into the community and saying, hey, this is a thing. This is something that's happening. It's happening in Montgomery County as well, and everybody needs to be aware. We quickly learned from our community that they were already experiencing the opioid epidemic in a variety of ways. So as we developed support, we understood that it was not just about fentanyl. It was about mental health. It was about learning skills, learning how to talk to your children about it, as well as connecting people to resources and understanding what resources simply weren't out there for our kids. We started going into schools with the help of our Health and Human Services partners to educate kids in groups or in grade level assemblies. Substance use prevention groups were introduced in several of our high schools, and there was a countywide Kahoot sort of knowledge awareness competition. We also took a look at our Narcan policy. So Narcan, the opioid reversal agent, has been available in schools since 2018. However, we took a hard look at, where was the Narcan in the building, increased supply in middle schools and high schools, and we wrote a brand new regulation talking about how we address potential opioid overdoses in the school. The regulation also addressed whether or not students would be disciplined if they were carrying a life-saving medication for Narcan. In our forums, we had been doing a lot of community training of parents, other community members, and students, older and teenagers, in how to use Narcan so they could save, a friend's life. And our policy that we wrote specifically addressed that they would not be disciplined for carrying Narcan in schools. However, really important to understand what the emergency procedures are in schools. We had a health curriculum update with more information about opioids, medication safety in particular, and had training with the National Poison Control Center of our employees, just addressing their concerns about illicit fentanyl exposure to substances. I actually just going to go back to this slide. I talked a little bit about community coordination, but one thing that I want to emphasize, besides the community coordination, is that all these efforts are along the entire spectrum of prevention and response. That little blue square there. It's not just about combating overdoses. You need to think about education risk, who is at risk, how do you modify those risk factors, understanding that there are some kids who are using and experimenting, what kind of harm reduction strategies can we put out, understanding what treatment is available, how to connect people to treatment, and then also doing recovery support and grief support. Too many families and people have lost friends and loved ones to opioid overdose in the past several years. The other thing that was a huge guiding principle for us was thinking about fentanyl and opioid overdose in a comprehensive mental health framework. So not just talking about fentanyl, talking about substance use, and then not just talking about substance use, talking about mental health, not just talking about mental health, talking about trauma. So all of these things that lead to risk behaviors and maladaptive coping strategies that are not the best for you, that need to be replaced with more support and better coping strategies, was something that was really part of a more comprehensive approach. And then the last thing is to really empower youth themselves to address substance use, to understand how to take care of themselves and each other, and to help parents understand how to better promote and support healthy behaviors and discuss sometimes complex themes with their kids. Can be really difficult to talk about mental health and substance use, so we spent a lot of time trying to bring resources that helped parents do that. So what is going on this school year so far? We again participated in National Opioid Overdose Awareness Day. Lieutenant Governor Aruna Miller was there. And right now we are partnering with the state's attorney's office on a district-wide PSA contest. So we've had over 200 students make video PSAs for fentanyl and opioid overdose prevention. This Saturday, actually, at Gaithersburg High School, they will be awarding the winners with the prize for the video that was voted the best by the student community. We are also working with student leaders to help get the message out in other ways, as well as understand how to better support them through health education and curriculum. We have been engaging parents in forums like these ones, but also, and I'm excited to talk more about this later, more like significant one-to parent-directed supports, as well as training sessions. Parent Craft is a training for how to address substance use with your child that is actually free for Maryland residents. So that's something that we're trying to get out there, and support for our parents and our parent volunteers in the school. We continue to manage Narcan in our schools. This year, we became our own independent overdose response program, which means that we can help the health department out. They were the ones previously managing our naloxone and our training events. And now we have a little bit more, we can do that within the school system. We were also invited to a national roundtable to talk about naloxone in schools. I think some of the work that we've been doing has been recognized as something that other places are trying to do in terms of empowering students specifically, and teaching them about life-saving medications. We continue to have district-wide forums. They're not necessarily dedicated only to fentanyl, like our 3 fentanyl forums, but at every one, there continues to be a lot of interest in mental health skills training, talking about substance use and Narcan distribution, and training. We found it was really important to offer therapeutic activities while we were also doing this kind of work. And one of the amazing things about the community forums was people finding each other and understanding they were not alone in negotiating the opioid epidemic, and just finding each other and having time to find joy, as well as do some hard work, really turned out to be the magic recipe. There's also another type of free training called ESPERT, which helps youth-facing professionals better address substance use and related issues, and do sort of some motivational interviewing with teenagers. So if you missed our family forums, they are available online, but I did want to elevate those because they were a place where we really were able to engage in the community and learn that everybody had different experiences and need to be supported in different ways. The Department of Health and Human Services is our closest partner in terms of the health services in our schools and understanding how to bring their expertise of the prevention and harm reduction program to benefit our community. So on the left, this is all the things that we do at MCPS. In the blue are the things that we do together. We bring in experts from Health and Human Services to do school-based youth outreach, the other partnership we have, not with the Department of Health and Human Services, but with Shepherd Pratt, is a recovery academic program. So that is an educational space where kids who've gone through treatment and are in recovery can start to work on their curriculum while also getting being in the therapeutic space every day. Health and Human Services also has youth ambassadors. They have, I think, over 60 high school students now from across the county who are there training to be peer educators in this space. I also want to make sure everybody knows about the Child and Adolescent Assessment Services. That is someplace where all children and adolescents in Montgomery County can go for a substance use evaluation and talk to someone about referrals, and that is with our is in our Montgomery County Crisis Center. Again, there are a lot of resources out there. I have a couple of resources listed in outpatient treatment, but there are certainly more available, though everybody would say it is not enough, especially for folks who speak different languages or for young people needing more intensive services. So what can we do to help? There's actually plenty that we can do. What we've been talking to everybody about is just get educated. You know, thanks for coming tonight, learning about this. It's not a fun topic, but it's something that I think people are worrying about because they're seeing so much on the news. Understand that the dangers of drugs and illicit fentanyl right now are very different than before. I think, in our minds, what we think of in terms of someone who's overdosing is that they are a heavy drug user, but now one pill can kill, is what the DEA social media campaign says. Kids can just be experimenting, or they think they're taking something else, and it can be very deadly. So understanding that that's very different about this epidemic is important. Using non-stigmatizing language, I'll share some resources about that, but the way, the words that we use to talk about mental health and substance use really matter. There are a lot of things that we say when we talk about being clean versus being dirty that make substance use, if you are struggling with it, very shameful. And if you are having a hard time, make it harder to reach out and to admit that you have a problem, and go to even trusted loved ones for help. Learning about Narcan. Narcan is an easy to use medication that has no kind of just like a nasal spray that you would use for your allergies. And it is very safe for someone, even if they're not having an overdose. And then learning about mental health resources and access to them. We're talking a lot to youth about spreading the word amongst themselves. Peer education, peer support is really powerful for teenagers. And youth are very generous. So, even in our Narcan trainings, we find a lot of them are thinking and worrying about their friends. They may be even worrying about family members' use. So understanding how to talk to people, how to recognize signs, that's a skill that youth want to learn. For parents and caregivers, we want them to speak to youth about the dangers of drug use, but also be, pretty firm and, what are the expectations? Sometimes we think that they know, but they might not know. So being very verbal about it, especially when they might be getting different messages from social media or their peers in terms of what is normal and what is safe. It's really important that we sit down with our kids and let them know sort of how we do in our family and what the facts are. Recognizing signs of substance use, but also recognizing when kids are struggling, signs of mental health struggling or trauma, intervening early before anyone turns to a coping mechanism like drug use is way more powerful than treating them afterwards. And then practice medication safety. So we'll talk a little bit about that in a minute. If you missed our fentanyl forums, there is a web page just about substance use and opioid overdoses on the MCPS public site, and you can watch videos of the forum and see what kind of questions folks asked. There's also some resources on our website, the medical officer website. The Department of Health and Human Services of Montgomery County has a great website called Know the Risks. And this is one place where you can go and sign up for free Narcan training. They have both virtual and in-person training, and they will list how to actually access Narcan. You do not need a prescription for Narcan anymore, but certainly if your doctor prescribes you an opioid pain medication, it's always good to ask them to prescribe you Narcan as well. And then Be the One is an excellent resource for youth in terms of how to talk about substances, how to support peers, how to support each other. I actually recommend it for everyone, not just young people, though it was developed by a young person for this purpose. Montgomery Goes Purple is our community collaboration. Lots of county leaders and community organizations working this space work together under the umbrella of Montgomery Goes Purple, and they have a wonderful website with a section just on youth and family resources, but a lot of other great knowledge too. So that's something to check out. You can also watch videos of how to use Narcan and schedule training through their website. So this is what I was talking about in terms of medication safety, understanding that certain medications can be dangerous and securing them. So if medications are not used or they're expired, disposing of them safely right away and safely, locking up medications that may be more dangerous, including opioids. And then these little purple stickers are kind of tamper-proof to make sure if somebody has been in the medication that you didn't intend to access that medication. But keeping a safe environment at home and making sure you dispose of medications is an important part of safety. We always want to make sure everyone knows what to do in a crisis. First of all, overdose is not just Narcan. It's a full-fledged medical emergency, right? So if someone has had so much fentanyl or another opioid that they stop breathing, that's a really serious medical emergency. Other symptoms might be that they are unconscious, they turn blue in their lips or fingertips, they are very pale, or they're struggling to breathe. Those are all indications for giving Narcan. If someone is totally passed out and they appear to have trouble breathing or are not breathing at all. We always want to remind folks that, especially young people, that if they're giving Narcan, they're also calling 911. Narcan reverses the effects of an opioid overdose, or it can at the right dose. Sometimes you have to give multiple doses, but the effect is temporary. So it's really important, just like if you give someone an EpiPen, to call 911 and to get appropriate follow-up. The other thing we tell people, especially young people who are worried they'll get in trouble if they help someone, are discovered to be in a space with illegal drugs, is that Maryland has a Good Samaritan law, which means if you are in a space and you assist someone to medical attention, you are exempt for prosecution for certain crimes. But you have to be the person who is getting help. You could be the person who's calling 911. You can be the person who is delivering the Narcan or monitoring your buddy. But there is a law that protects, and being scared that you're going to get in trouble for helping your friend or for calling 911 should not be a barrier if you're the person right there who can save a life. We've had some disturbing research that shows that in over half of the overdoses, there was a spectator or someone very close by who could have done something and intervened, and for some reason they were not able to. So making sure people have Narcan and understand that they won't get in trouble for using it is really important. 988 is the new suicide crisis lifeline. So everybody should know 988 is like 911, but for medical emergencies. And in Montgomery County, we also have our 24/7 crisis center. There's an app called MCPS Stronger Student that has 988 and a lot of the emergency numbers that kids may need right on the app. Lastly, I wanted to just make the point that there's more out there to talk to our kids about besides fentanyl and opioids. In July of this year, we had legalization of adult recreational use of marijuana, of cannabis here in Maryland. So we've been doing a lot of work with our county partners and now with the state, just trying to think about what is the impact on what is the impact going to be on youth? They're still not allowed to use it. It's not legal for people under 21, and nobody can use on school property. But making sure that they don't get the message that it's safe for them because it's legal, and making sure folks have the appropriate supports, anticipating it might be more available now in the community. So we are doing some of this work around cannabis. Vaping is another area that we've heard a lot of parental and student concern, so there'll be more to come in those areas. I mentioned Parent Craft. It's free training for Maryland residents. It's a self-paced online video course that's asynchronous and really, really helpful. I think it can be helpful even, if you're not worried about that your child is using, just in terms of understanding how to talk to kids about the topic of substance use and other challenging conversations. The Recovery Research Institute also has a more simple resource guide. And some of the important things that it brings out is, being a role model. Kids are always watching, so making sure that we model healthy behaviors and are doing things that are positive and participatory with our kids. They're only going to talk to you once every 10 questions. So making sure you have a lot of space to develop your relationship is really important. Setting clear expectations. As I said, we cannot assume they know what we're thinking and what we support as behavior that is safe and acceptable versus not. And then setting limits, and most importantly, following through. So if you have rules, discussing them in advance. So these are all things that you can read in the guide. Just understanding what your kids are going through, knowing that there may be barriers sometimes to them confiding in you. You really just have to create a lot of space and understand that and help them understand that not saying something could be way more dangerous than a worry they might have that you'll get mad about asking them something that a friend may be doing. And then the last thing that we want to talk about is taking care of yourself is more challenging and more important than ever before. Parents are going through a lot right now. I'm sure everybody is feeling that. And in order to take care of kids, we need to be the best versions of ourselves. So it can be so hard to you sometimes feel guilty as a mom doing something for yourself. But really important to know what those boundaries are and understanding that when we are healthy, we're better able to support others. Sometimes it can seem, especially for teenagers, that they're not listening, that they don't care what we say, but in fact, that's not true. You as a caregiver and parent are the most important adult ally in your child's life. All right. I'm glad we'll have time for questions. One last plug. Again, this is for our video contest with the state's attorney, Speak Up, Save a Life. The contest results are going to be announced on Saturday, and there's the QR code if you want to learn more about the contest. But thank you so much for your time and taking time to learn about this important subject today.